The posterior drawer test tests the posterior collateral ligament. The patient is lying supine with knee passively flexed at 30 degrees. The AT will sit on the foot to support the ankle, palpate joint line on both sides of patellar tendon, provide a posterior pressure and feel for any tibial displacement. This test is highly sensitive and specific, so it is useful to rule in and out a PCL injury. The valgus and varus stress test tests for MCL and LCL damage. The varus test will start out with the patient supine with a knee flex at 25 degrees. Support the lateral portion of the distal tibia, other hand grasps knee at medial joint line. Apply a varus force while the tibia is moved forward. This will test for lateral collateral ligament damage. This test has a low sensitivity and would not be recommended in ruling out. The valgus test follows the same procedures, but you will apply valgus force instead. This tests for medial collateral ligament damage. This has a high sensitivity, so it will be recommended in ruling out. The Slocum test is similar to the anterior drawer test. The patient will be lying supine with the knee flexed to 90 degrees. Internally rotate the foot to 25 degrees and apply anterior pressure, anterior force. This tests for anterolateral capsular instability. Now, apply externally rotate 15 degrees to test for anterior medial capsular instability. This test could also be indicative of ACL, LCL, IT band, popliteus tendon damage. There's no data for this test to rule in or out.
All right, this is the SAG test. The patient is supine with the knee flexed at 90 and the hips flexed at 45 degrees. You're palpating the tibial tuberosity to feel for posterior displacement of the tibia. You're looking for a posterior drop in the tibia. This is indicative of a PCL sprain. The sensitivity is 79, the specificity is 100%. So this definitely rules in and out a PCL sprain. All right, this is the Renée test. The patient is standing and you're palpating the Gerdy's tubercle. You have the patient perform a one-leg squat at about 30 degrees. If there's pain with this movement, it's indicative of iliotibial band friction syndrome. The sensitivity, specificity are inconclusive.